Hi, I'm Dr. Mary Shackelton, naturopathic doctor in Boulder, Colorado. I'm on a mission to teach people that detoxification goes way beyond the 7-day cleanse. I've seen the fallout in my clinic from people detoxing way too quickly and doing it incorrectly, and I want to set the record straight on how to detoxify. I want people to understand what the tipping point to toxicity is and how that puts them at risk for chronic disease. Today I want to talk about sweating, one of my favorite topics. Most Americans, you can overhear them boasting about not being able to sweat. I don't really sweat much. That's not what I want to hear. I love it when I hear patients say, I sweat profusely. To me that means that their sweating mechanism is upregulated and they're detoxifying easily. A lot of patients wonder if they're toxic and if they could benefit from sweating. Here's a few signs and symptoms that you might have chemical or heavy metal toxicity. You might have a diagnosis of fibromyalgia, digestive problems, night sweats, cold hands and feet, dark circles under the eyes, chemical sensitivity, depression, tremors, chronic fatigue, inability to lose or gain weight, rashes, candida, headaches, muscle and joint pain, anxiety, allergies, brain fog, and low temperature. These are a few of the symptoms that suggest that you might benefit from sweating. What I've realized is that we can actually forget how to sweat. That with an accumulation of toxins, our ability to sweat declines. This very thing happened to me. When I started sitting in my own infrared sauna, I didn't sweat for up to 35 to 45 minutes of the sweating session. And after 4 to 5 sessions, I started to sweat within the first 10 to 15 minutes. By sweating frequently, you can remind your body how to sweat and therefore increase your ability to detoxify. Often, our exposures to chemicals and heavy metals decreases our ability to excrete them. So it becomes a vicious cycle. As our exposures increase, our ability to sweat decreases and our total toxic burden increases. So heating the body's core temperature by just a few degrees for 15 minutes or more can disable or disarm cells that are infected with bacteria, viruses, parasites, or that have damage to the DNA that contain chemical toxins or heavy metals. Think of toxins as being in many different layers in your body. Some are more superficial than others, and to work down to the deeper layer of toxins, it's going to take some time. So the idea is to work consistently through all these layers of toxicity and then maintain a lifestyle that supports ongoing detoxification, such as sweating 1 to 2 times a week, minimizing your exposure to toxins, and eating a diet that's rich in phytonutrients. Patients often ask me, how much do I need to sweat? Some experts say that 10 to 30% of the toxins that would be excreted through your kidneys and liver can be excreted through your skin. So I find that many patients have questions about saunas. We're going to talk about the infrared sauna here that's in my clinic today, and I wanted to talk about several of the other types of saunas that you might have come in contact with. The traditional sauna, typically found in health clubs, gets very hot. It's typically heated with a wood or heating coil, and it can get between 180 to 210 degrees, often producing discomfort for a lot of people. If this is the only sauna you have access to, jump in it, make sure you hydrate, and get out if you feel dizzy or faint at all. This is a far infrared sauna. It doesn't emit a particular light, but it emits a particular frequency that can penetrate the skin up to 1.5 inches. The temperature for a far infrared sauna is lower than that of a traditional sauna and therefore a little bit more comfortable for people. So I usually instruct people to sit in the sauna for 35 minutes on their first session and up to 55 minutes a couple times a week. This is a 2-person sauna. One of the nice things about the far infrared sauna is that they don't get terribly hot. 125 to 155 for most people will produce a pretty good sweat. You can sit in the sauna for up to 3 hours a day in divided sessions, providing you're drinking enough water. After you're done sweating, we really encourage patients to step into the shower to rinse off the toxins that have come out onto their skin through their sweat so they don't get reabsorbed. There's another type of sauna called an infrared lamp sauna, and it's actually a red lamp that people can make their own sauna in a closet at home. A maximum of 2 hours per day can be spent in an infrared lamp sauna. And the final sauna that people are mostly familiar with is a steam sauna. This is a traditional sauna with a heated element with water poured on it. And there's a tremendous amount of humidity in the air. Not as much sweating happens in a sauna that's wet as it does in a dry sauna. So my preference is either a traditional dry sauna or an infrared sauna. I encourage all of my patients to sweat on a regular basis, not only to support ongoing detoxification, but to help them regain their vitality and their health.